Hello, everybody. Adrian Meleto once again from Miami Acupuncture Therapy on your channel, Meleto's Revolutionary Remedies. And today we're going to talk about thermography screening in light of October Breast Awareness Month. What is thermography? Basically, it's a screening method used to detect anything that might be abnormal in the body using heat detection. It's like a camera, the same one hunters use for hunting and night vision, etc. And it detects changes and differences in temperature of the body. For example, thermography is used, even though it could be used for like detecting inflammation and pain, etc. It's used mostly for cancer screening. Now, the heat in itself is not diagnostic in itself, because just because an area is warmer doesn't mean anything, but it can indicate something that needs further looking into, and it could do it years sooner than any other diagnostic method can. Well, not diagnostic method, but screening method can. And just that alone is very important, whereas when you do have a finding, then you can get like a follow-up with another screening method, such as like ultrasound or something like that. Usually, many people do follow-ups with the actual mammogram, but sometimes, not necessarily. A mammogram will still not detect things as early as thermography, which I'm explaining in a little case that I'm going to talk about in a minute. But basically, the way it helps detect any abnormalities is, for example, if there's an area of the breast that's a little warmer than the other and it's kind of like a little asymmetrical pattern of heat, there it could indicate an abnormal accumulation of cells or cancer cells. Another advantage is if the individual has too much estrogen in the body, which is actually predisposes a person for getting cancer. The heat signature will come out as like extra cold, like unusually cold throughout all the breasts. And with further screening and testing and laboratory testing, if the individual does come out with too much estrogen, then the person can, do an intervention for doing that, and that in itself will help prevent the incidence of the breast cancer. And you can detect it years sooner than a mammogram. It's safer than a mammogram because a mammogram, you're actually compressing the breast. And if you do just happen to have something that's maybe just limited to the breast, by compressing the breast, which is right next to one of the main lymph vessels here, you could actually squeeze it right into the lymph and have something spread throughout the body. So you're increasing the risk. So the modern medical standard of this type of screening is, in my opinion, questionable. So, in addition to the compression, squeezing out, like if you have any type of implant, it could kind of maybe dislodge it, or, there's always like some kind of risk involved. There's radiation, whereas with thermography, there's no radiation. There's no touching, there's no anything. It's just like taking a picture, because it's just detecting heat. And it's great. And follow-up screening could be done with ultrasound. So I don't know why it's not covered by insurances the way mammograms can, which is basically, the mammogram is the prevailing screening method in conventional medicine because it's basically what's covered by insurances. But thermography should be covered as well. I know there's a few health share plans like Liberty, etc., like that might cover it, but for the most part it isn't, although it should be. Another thing that thermography screening can pick up, which a mammogram cannot, is the inflammatory form of breast cancer, which a mammogram cannot detect. And usually the prognosis of that type of cancer is very poor, and caught early, an intervention can kind of help the person's survival rate. So there's many reasons why someone should get a mammogram. And speaking of getting a mammogram, one might ask how often one should get one. I know the standard protocol for a mammogram is once a year, but a thermogram should be first, the first one just to establish a baseline, then one 3 months later to have like a comparison between the first and the second, and then 3 months after that, just to make sure there's a consistent pattern. If something's detected, then it should be more frequent, but otherwise, if not, then from then it should be annual, now that there's like a baseline established. And everyone should get one, particularly women who are in their 30s. Once you reach 30, you should get one so you could detect it early. When you consider that statistics that 1 out of 8 women will get some form of breast cancer, and it's the number 2 cancer killer among all the cancers, it will behoove a person to get this type of screening. I definitely think it's worth the investment. We do have somebody that comes to our office to do it periodically, so if that's something you might be interested in doing, you may contact us to see, and we could set something up. As far as the case I was telling you about, there was an individual who they established a baseline and they found something a little asymmetrical. It wasn't anything definitive, but the person came back for another scan 3 months later, and then something a little bit more was distinguishable. The person went to follow up with an actual mammogram, but nothing was found, and the medical doctor said come back a year later, but for the follow-up mammogram, but the person came back for a thermogram 3 months after the second one, and the thermography showed it was getting something worse, more defined. And then at the insistence of the patient, they finally went for an additional mammogram after the 3rd month after that, and then they found something. And because of the thermography and because of the insistence of the patient, they were able to find small calcification, and within 1 week a lumpectomy had been performed with good margins, and the pathology confirmed as malignant carcinoma. The patient now has had stable thermograms for the last 2 years and is expected to remain healthy. So that's one perfect example how thermography can catch something early, whereas the mammogram probably wouldn't have caught it in time, and the person was able to have an intervention and a successful intervention and prevent something. So this month I'm going to try and see if I can get another video out regarding cancer, etc., since it's Breast Cancer Awareness Month, and let's save those tatas.